This is the Gate Lab. It's a big, beautiful space here in Richards, 4th floor, where there's lots of great research going on for human movement. And it's really great for analyzing how people walk. There's different researchers that are using this space to understand or assess different aspects of human walking. We've got about 30 motion capture cameras. They're tracking the positions of little retroreflective markers using infrared. And then we have force plates in the ground as well as underneath the treadmill to figure out what the ground reaction forces are underneath the feet when someone walks. And by tracking the motions of these markers, which we tape to people's joints, and by tracking the forces underneath their feet, we can figure out what the forces are on their knees, ankles, and hips.
My name is Glenn Moyer. My prosthetist works with researchers in the area. And Max Shepard, Professor Max Shepard, reached out to my prosthetist looking for test subjects. And I have volunteered at other places that are doing research, and I do enjoy doing this, helping folks research work. And so it's through my prosthetist and an introduction, and then I've been to the lab one other time before this to basically be a test subject and walk on developmental prosthetic feet so far.
Hi, I'm Max Shepard. I'm a new assistant professor at Northeastern. I'm a joint appointment 50% in physical therapy and 50% in mechanical and industrial engineering. My recent research is really looking at the prescription process for prosthetic feet. The way prosthetic feet are prescribed is really based entirely on two factors: patient weight and a general notion of how active they are. And that's missing a ton of the differences between these prosthetic feet. And so I'm trying to create clinical tools that can be used to dial in the best behaviors of a prosthetic foot for a patient, and based on that we can then purchase the right foot for that person. I would love in the future for prosthetists to have access to a tool that allows them to dial in these mechanics to figure out exactly what foot would be best for each patient. And so my hope would be that this research actually makes it into the clinic in the near term.
It's how we advance technology, and I've always been curious. I've always enjoyed tinkering and building and creating, and so R&D is all of those things. I would urge anybody that has an opportunity to participate in research like this. I think it's important to help the people doing the research. They need human test subjects, and if you get an opportunity to do that, I think it's something that amputees should try to do to help progress.